With summer almost here, a lot of us will be thinking about getting that summer look, right? Which means a tan, but doctors say that does not come without high risks. Skin cancer is the most common type of cancer in the world. Approximately 1.5 million new cases are diagnosed each year. So it's really important to know how to protect your skin. And today we have Chris Stoner and Doug White here, both nurse practitioners with Franciscan Health. Thank you both for being here.
Thanks for having us.
Appreciate it. So right off the bat, how do you know if somebody's high risk?
Well, it depends on a few factors, but as we get older, we're at a higher risk to develop skin cancer, skin lesions. Family history of skin cancer too is up there. Fair complected people have kind of a higher affinity for skin cancer and issues like that too. And then if you just have a history of being out in the sun without sun protection, tanning beds, those are another thing to think about.
What about prevention? What can we do to prevent getting skin cancer?
Number one thing is wearing sun protection. So if you're going to be out in the sun, wearing an SPF 30 or higher, and kind of is recommended to apply every 2 hours. If you're going to be doing things like swimming, a lot of sweating, applying that more often than the 2 hours. Like SPF 30 can give you like 97% protection from ultraviolet rays of the sun that cause sunburns and then ultimately can lead to skin cancers.
What about skin protective measures like a shirt, like a swim shirt? Is that is that
Swim
preferable or
hats? All that is definitely beneficial.
okay?
And then just not exposing your skin to the sun as much as you can.
What should I be looking for on my body, and how often should I be looking for it?
Yeah, I think that's a good question. At least once a month, kind of look, see what's going on. It's hard to see behind, so if you've got somebody that can look there, look into a mirror to check too. But you're looking for new lesions that are popping up fast, growing. We talk about the ABCs, you know, of skin lesions.
Yeah, it's like when you look at a skin lesion, the A is asymmetry. So if you like draw a line through the middle of the skin lesion, does it look the same on both sides? B is for border. Does the border look scalloped looking or just irregular looking? Color, is that color changing? Is it darker on one side versus the other? And then diameter, like kind of anything that's over 6 millimeters is something you want to get looked at by a professional.
And to put that in perspective, what is that? 6 millimeters?
About size of a pencil,
Okay.
Pencil eraser,
Gotcha.
head of a pencil eraser. So, and then E is evolving, kind of that change in color, size, shape of a lesion. And that's kind of one thing we always kind of stress at our annual visits with patients. We ask them, do you have any new skin lesions or moles or anything that's changing with your skin?
And you talk about annual visits. I was going to ask you, when should I come see you? At what point? Annual visits are important, but then when we find something that is troubling from those
Correct,
ABCs?
Yeah, I think honestly, if you find something, it's a good idea to probably ask your primary care about it, to check it out. If it looks odd, just like anything with healthcare, if something seems off, you know, say something about it. And just like I'd say once a year, that's a good time to do an annual skin check. Sometimes your PCP may say, hey, why don't you go see a dermatologist, especially if you've got like a significant history of skin issues. And yeah, we can get you referred over to dermatology and do a lot of stuff in the office too.
But it starts with you, right? The primary care provider, and then typically get a referral to a specialist?
Yes and no. I mean, you can sometimes call a dermatologist directly. Some insurances, it's kind of determined on what your insurance requires, whether they need that referral or don't need the referral.
In my experience, my family's experience, it's a whole lot easier to go see you first. I can get in to see you in a day or two versus an appointment with a dermatologist or the specialist. All right, what else should we know? Anything else you can think of?
Just be vigilant, right? Check your skin. Don't brush anything off. If anything looks odd, definitely come and get it checked out.
And then definitely do that monthly skin check, looking at all areas of your skin, palms of your hands, nails, getting that small handheld mirror to look at your back, look at your scalp. Just being diligent on knowing what's on your skin and keeping an eye on what's changing.
All right, Chris Stoner, Doug White, thank you so much for being here. Really
Appreciate it.
appreciate it.
Thanks.
All right.